Yes, and thank you for this opportunity. My name is Nathaniel Smith, and I serve as the founder and chief equity officer of the Partnership for Southern Equity. We are a multi-issue racial equity organization that is working to realize a new Southern agenda for shared prosperity and inclusive growth in Atlanta and the U.S. South.
Thank you. Monica Coleman, she, her pronouns, and I am a program officer in our research, evaluation, and learning department at the Robert Wood Johnson Foundation. I also co-lead research, evaluation, and learning for our Leadership for Better Health strategic portfolio. I'm based in Mississippi, and I'm very passionate about bringing more investments to the South. I can jump in and say that, as a person that's working in philanthropy, an organization that's particularly focused on health equity, we know that access to resources really makes a difference in outcomes. We have decades of evidence that tells us that if we address the root causes of this problem, structural racism being one of them, then we can actually help people get access to the things that they need to achieve. What our vision is, making sure that health is not a privilege, but a right for everyone, regardless of their zip codes. Particularly when it comes to resources, we know that people that are proximate to more resources tend to have better health outcomes. And that's why we see in our county health rankings disparate outcomes in health. It's not about the individual, their social economic, their race, or any of that. It's literally about access to be able to have the things they need to thrive and make good decisions and take care of themselves. And not just in terms of access to health care, but access to a built environment that facilitates thriving in a community, access to, quality education, food, real food that can help them avoid disparities such as, diabetes, high cholesterol, et cetera. And so in communities where there are not resources that help people to access the things that they need to thrive, we see those outcomes look very different, and we see those inequities.
Yes, and we know that unfortunately, um, investments usually reflect the values of people in power. And if communities aren't valued, then unfortunately, historically, they're not funded or supported in the way that they should be. And that's why it's really important for us to fight for the intrinsic preciousness of all people. And by doing that, we can work to ensure that those communities have access to health resources by first understanding those social determinants and really understanding how historically, how power specifically has influenced what has been supported, what communities have been supported, what places have been funded and supported, and how, as a result of that lack of support, how the social determinants in those communities continue to minimize the opportunities for health and wealth and opportunity in those communities. And so we have to be honest about history, honest about how decisions have been made, and even more so work to right the wrongs that many communities are experiencing as a result of the history of structural injustice as it relates to health investments.
Yeah, and I'll just add a little bit more to that. So I appreciate what you just said, Nathan. I'm thinking particularly about some of our investments in a guaranteed income program. This was a community that we funded in the South of women who just needed a little bit more income to stretch their living, their expenses, to cover things. And through that guaranteed income, some of the participants were able to go back to school and finish college. Some of them were able to move into independent living, getting their own apartments and homes. And, it took a small amount, but it made a large difference just because so much wealth is hoarded in certain places. And so we really need to think about who really needs these resources and how, it's not about equality. Everybody getting the same thing is not the issue, because that actually can be unfair. We need to think about what unique groups of folks need and individuals need, so that we can lean into equity framework to help people reach their goals to thrive.
So, I would say that you know public policies are have been leveraged for centuries, really, to influence the and shape the systems that continue to affect vulnerable communities. And if we just look at historically at federal policy, specifically whether it be transportation policies with the Eisenhower Act and its encouragement of suburbanization and the lack of resources for predominantly Black and historically disinvested communities of color, to our real estate policies, in particular around redlining and how, an extractive form of economic development has, pulled many resources and economic opportunities away from disinvested communities. We can also look at how that has not only affected the real estate dynamic in many underinvested communities, but also the access to quality foods, to walkability, to good infrastructure. All of those things have been affected by the policy decisions of both the local and federal government and national government, state government. And all of those have conspired in many ways to harm and hurt communities. And so that is why we have to look at it in that way. How policies have helped to shape systems, and even more so, how can we leverage policies today to actually heal the communities that have been harmed by the historic injustices that have been perpetuated by inequitable policies in communities of color?
Yeah, those are all important things to lift up examples, and I think I'm going to lean a little bit into, data and research, and talk about, the historic disinclusion that we've done for people, especially people who are closest to these issues that research is supposed to be addressing. We have typically not included, historically, not included community members in the research that we claim to be doing to support them. And that has created a top down approach that really hasn't centered their voice and their agency and their lived expertise. And so I believe that the data that we have produced is based on a colonized approach to what needs to happen. And so these policies that Nathaniel is talking about often come from a lens of somebody looking on the outside, looking in and saying that they know what's best for a community based on what they think should be happening, rather than the community itself creating and disseminating and lifting up their own data to to win the policies that will work best for them.
That's wonderful, Monica. And at the Partnership of Southern Equity, we do believe that the people that are closest to the problems are actually closest to the solution. And, as we continue to try to find solutions to some of the pressing challenges that are facing our most vulnerable communities, the solutions will not be found without the people actually being a part in the creation and implementation of those solutions. And so it is important for the folks that have everyday experiences, that are experiencing the injustices that we want to remediate, that they have to be front and center, and in many ways leading the research and the development of the strategies that are required for us to win.
I'll share a story with you of someone that Nathaniel and I were recently at a conference with. She sat at the table with us, and this is a young lady down in Florida doing some organizing work and just very powerful. And I sat her at the table with another funder to talk about her work. That funder wasn't supporting her. We were already supporting her. But when she sat at the table, she said, "Hey, I have some food on my table, but the people in my ecosystem, they need support. And so what I think happens when you bring people in the room who have lived expertise, they work more collectively and they care more about just themselves. They're always trying to bring more people to the table to make sure that the resources are distributed equitably. And that's why we need more people with lived experience who are close to the issues, because they're not as greedy. They're thinking about, how do we share things? How do we make sure that everybody wins? They're thinking about my success. What she said was, if my ecosystem doesn't survive, even though I have food on the table, I won't for long, because I need the support of my ecosystem. And so she's out advocating for her people to get more resources, even as she needs to do the same herself, but she's thinking about more than the one person, right? More than the one organization. I think in order for us to get to this place where we're being more equitable in resource distribution, we need many folks to be like that, to think about the other folks around them that need that support, and to be willing to collaborate and share and take what they need in the moment, thinking about the future as well, but not hoarding. I think hoarding is a real issue when it comes down to really equitable distribution.
Yeah, and I think sometimes as people of privilege, we lose our sense of urgency, and our sense of empathy as relates to what everyday people are going through. We also believe at PSC that empathy is the bridge between love and action, right? That without empathy, it's very difficult sometimes to galvanize the resources and the people that are required for real change to occur. And unfortunately, we're living in a time where our nation is experiencing a bankruptcy of empathy. We're now in a time where you're actually rewarded for turning your back on the people who need you the most. And so we need a revolution, really, as it relates to empathy, and really begin to think differently about how the people that are suffering are more connected to us than we want to understand. That there is that the network of mutuality that Dr. King talked about was a real thing. And so we have to begin to have a revolution of empathy if we want to move forward. And then we also have to make sure, again, that we're listening to understand and not to respond. We have to begin the process of creating environments where we're actually listening to the people, learning from the people, and co-creating with communities in ways that will allow us to be more efficient with the resources that we have, and that we can leverage in order to make communities whole that have been harmed by past policies.
Absolutely, Nathaniel. And I'm just thinking about some of the heal, back to the healing piece. And I think words like empathy and love, and radical love, and radical transparency, we don't talk about them enough, and we definitely don't lean into them enough. But I think those are, when we really look at structural racism, when we look at these societal ills that have created this inequitable distribution of resources, those are the things those are the illnesses, right? And we really need to get at them as well. And unfortunately, I don't think we invest enough in that type of work. But whenever you're talking about bringing people together collaboratively, the question I always ask, well, why aren't they already working together? And there's some history there that we need to dive into and uncover and create the spaces for people to, lean into that restorative practice so that we can come together and move forward collaboratively with solutions.
And I would also say that quickly that trust is another critical ingredient in creating a new world where everybody is looked at as precious and important. Unfortunately, there's a history of great harm that our health industry has perpetuated on communities of color. A lot of times Black communities have been studied and exploited as a result of our health system. And when it comes down to Black people and communities of color, a lot of times the Hippocratic oath is left in the desk, and not used in the understanding of how to engage vulnerable communities. And unfortunately, the trauma and the harm that has been caused as a result of that culture of extraction has created a lack of trust of communities in the system, and the leaders of that system, and the resources that could come from that system, um you know and it has created really a lack of opportunity for collaboration because of this lack of trust. And this trust is not just lack of trust, didn't just come out of anywhere or nowhere. It came from a history of harm. And so we have to get the trust of the community back as well, and work for that trust if we also want real change to happen in the communities that we serve.
I can jump in. For us at Robert Wood Johnson, and for myself personally, it's about the redistribution of power. I think, for too long, we've had these imbalances in who gets to decide, who gets to ask questions. And this is across many sectors. And I think in order for us to get to a place where we can actually move resources, we have to first shift the power so that people can make those types of decisions and have self agency and self determination. Until we actually do that part of it, the power piece, and get more comfortable talking about power and acknowledging its role in the inequities, I think we're going to just be talking in circles.
Yeah, Monica, I think that we first have to invest in the strengthening, really, of the agency of frontline leaders and organizations, so they can not just be at the table, but also dictate what's on the menu. And it takes time to really grow the agency of organizations and communities, but we have to be committed to that, right? I think the second thing that we have to do is really begin to utilize research as an organizing strategy to facilitate power in communities. At the Partnership of Southern Equity, we call that the battle of the baseline. I mean, there are a lot of assumptions that policymakers and philanthropists and other groups make about communities, about where the opportunities for change are, where the harm is, what the investment should look like. And I think that we need to reimagine that whole process around how the problem is defined and how success is measured. And so I think in many ways that can be done by really looking at research is not just a fact finding proposition, but a real place where change can live, and that research can play a role in making real change happen that is felt positively by the people that we say we serve. And then, of course, the last thing is that we have to begin to not just look at policy, but also look at the delivery systems, right? That policies help to create, and that resource providers use to get those so-called resources to the communities that are in most need. And on many occasions, those delivery systems are inherently racist in their design, and so we have to either work to fix those systems in ways that will facilitate equitable investments, or replace them with new systems, delivery systems that see again everyone is precious and beautiful.
Absolutely agree.
Right. So one example I can provide is some work that we had an opportunity to do in Georgia, in 12 of the most underserved rural counties in the state, through an initiative called the Two Georges Initiative, where we worked with a funder to provide technical assistance, training, and also funding to hubs of community leaders in specific counties to actually begin the process of developing not just a policy based approach, but a people based approach to health equity in those particular communities. Some communities focused on housing access and healthy housing. Some communities focused on transportation equity. This occurred during COVID, right? And so one community organized around equitable equitable distribution of food and also resources during that time. And so, again, we leverage the Two Georgias initiative as a bottom up approach to ensure that those communities are connected to the resources that are required for them to advance health equity in their respective communities. There's another current initiative that we are leading called the Climate Change and Health Equity Initiative in 7 of the zip codes in the city of Atlanta, where again, we're beginning to engage frontline leaders and organizations to begin not only the process of facilitating influence and power through organizing, but also having crystal clarity on what are some of the policy solutions and advocacy opportunities that they have in areas like extreme heat or areas like health quality, air quality in their house, or the challenges around the energy burden issues in their community. So again, we're educating them, engaging them, positioning them to lead, and helping them to understand what the challenges are and how all of the individuals that live in those zip codes can work together to advance the health equity.
Yeah, and with all due respect, I think I just have to lift up that we're on a learning journey here at the foundation about how to be more equitable in distributing the resources that we steward. And for a long time, we have leaned on Nathaniel and his organization, Partnership for Southern Equity, for intel around the South and what's happening without actually funding his organization. And so recently we made a decision to fund his organization. And I think that was one of the best decisions that we've ever made. It's really helped us understand how to approach investing in the South with more humility, with more understanding of the culture and the needs of the people, hearing from the ground up to us so that we can be responsive in that way. As a result of some of the work that Partnership for Southern Equity helped organize, our Healthy Communities team is now making a significant investment in economic development in the South that's led by organizations on the ground. And so for me, it really does, these relationships matter. That's the first piece for me. And then listening and responding, something that Nathaniel has already spoken to earlier. I think that's our role in philanthropy. I think in research, we have to get back into, who's the expert, who gets to ask what questions, and then resourcing folks that we know are closest to the issue, because we actually took inventory in our research evaluation and learning department. And we noticed that we had been predominantly funding academic institutions, and we had not been putting money into communities. And so we, a few years ago, decided to shift our strategy to try to balance out that dynamic. And for us, it was a power imbalance. And so that's why I talk about power a lot. And we're still learning how to do that. There are some structural barriers inside of these philanthropic institutions to moving money to some of the organizations that need it most. And these are things that we're still on a journey of making, how do we make more equitable grant making practices a norm within our organization? And so these are just some of the things that I think can really shift some practical examples. But I think we just have so much more to learn, because this is not the norm, to even think about equitable distribution of resources. Some people frown upon it. Some people feel like you're taking from them, the zero sum game, And so we're countering a lot of false narratives about what this can look like and the importance of it, but we still persist.
And also, I would be remiss if I didn't lift up the type of commitment and leadership that Monica is bringing to this discussion. I've had to deal with many foundations and partners over the years that have been interested in engaging in the South. And on many occasions, they look at bringing outside influence and outside leaders in order to solve Southern problems. And that is a big mistake. And what Robert Wood Johnson, through Monica's leadership, is beginning to honor and understand is that the change, the solutions to the problems that we have in the South have to be solved by people in the South. It has to be solved by organizations in the South. It has to be, realized by the imaginations of people who are from the South. And so, and I think that is a very important way of looking at change work, because it's not just about how you enter, into a particular community. It's also about how you choose to lead. And if you believe in leaving something behind, um, from your philanthropy, to me that creates the greatest opportunity for change. And if you see the people that you serve as the people who have the solution, um, to the issues that you're trying to change, then I believe you're on your way to long term change in that community.
Just grateful for the time today with Nathaniel. We do get to talk quite often because we've become partners in this journey to get more resources to the American South, and it has not been easy work. But working with him has made it worthwhile work, and the journey continues.
Thank you, Monica. And for me, as usual, when I have an opportunity to lift up the genius and the heroes that are found in the South, I always like to use these opportunities as well as a charge, a charge to hope that will hopefully encourage people to see the South, as the real place where the tipping point can happen, for the change that we want, not only in the nation, but in the world. That the South is the place where the Southern freedom movement, led by so many great leaders, began, and its impact reverberated out not only across the country but across the world. And I believe that again, this is our moment again, to make the type of changes and to resist the injustices that we're facing. And I just want to invite anybody that's listening to this to also be a part of history by being engaged in the work that we're doing in the South.
This is a funny story that I actually like to share with a lot of folks. The story of how I met Nathaniel. I was new into philanthropy, but I was already stomping around the Robert Wood Johnson, offices, asking folks who's working in the South and how can we fund in the South. And someone told me about a young lady named Dr. Keisha Harris with Keisha Harris and Associates. And they were like, about a decade ago, Keisha was doing some work around Southern listening and helping us to try to understand how we could do some work in the South. And they were like, you should go look up those reports. And I did. And then I also reached out to Keisha and I said, hey, I want to pick up this work that you started. And, I don't know really who I should be talking to. And she said, you need to meet with a young man named Dwayne Patterson. And Dwayne was working in philanthropy in the South in Atlanta. I was on my way to a conference in Atlanta when I said, Dwayne, can we grab breakfast? And he said, yeah, can I bring somebody? And Nathaniel showed up. And I had breakfast with Nathaniel and really enjoyed all of his visioning and thought leadership. And then realized after the breakfast that I had been following him on LinkedIn for years and liking all of his posts. And so I feel like fate brought us together. And I think it was just history from there, figuring out ways that we could, distribute some resources to his organizations and his colleagues in the South and others. And then we go around, we tend to bump into each other a lot at conferences because we both are on the same mission, I feel, and we support each other in that way. So that's my story, Nathaniel, and I'm sticking to it, but you might have a different version.
Well, I don't believe in serendipity or chance. I guess that's just being around a lot of black preachers growing up. I just believe that God is in everything, and I just believe that really the divine brought us together, and I'm just so happy that God created an opportunity for us to be together during this critical time, and so when things are ordered in a way that you just can't understand, then all you can say to the universe is thank you. And I just have a lot of gratitude.
That's wonderful. Thank you so much.